So what is the difference between an anxiety attack and a heart attack? Unfortunately, a lot of the symptoms are very similar, and that's why it's a confusing process. I can remember my first panic attack, anxiety attack, whatever you want to call it, like it was yesterday. It was one of the worst moments of my life. I thought I was going to die. Um, I had some chest discomfort. I had tingling, numbness, stomach cramps, chills. I was shaky, depersonalization, uh, racing thoughts. I was hallucinating. I had everything in the book, every symptom you could ever imagine. All right, so I was convinced I was having a heart attack, and it turned out to be an anxiety attack. If this is the first time that this is happening, that's when it's the scariest. Okay, so if you're going through that, I mean, I understand it's the scariest thing that has ever happened to me in my life. It felt so real. Okay, and I remember getting on Google and looking up the symptoms. I was like, oh my gosh, this is this, this is this, this is this. They're very, very similar. So it's very hard to tell the difference. There's a big gray area right there, okay? So I'm going to try to do the best job as I can to give you a few little differences that might help you out here, okay? First off, if this is the first time happening, going to the doctor or the ER or the hospital to get some tests run on you is not a bad idea, okay? Because you want to get that reassurance. You know, if you really have trouble breathing right now, I mean, you can't breathe. And there's a difference between hyperventilating and literally oxygen just not getting to your brain. With an anxiety attack, you're hyperventilating. There's actually a surplus of oxygen coming in, okay? You actually have too much. That's how I would be. I was just breathing heavy like that, you know? I was causing, you know, an overflow of oxygen going to my body. Now, when it comes to a heart attack, there's like a decrease of blood flow. That can either be happening in your brain or other parts of your body. It's, you know, blocked blood flow. So that's whenever the numbness gets kind of scary, okay? So generally it's the left area, the left shoulder, and there's no, you know, golden rule with this. These are just symptoms, okay, signs. But I had numbness, and I generally had numbness kind of on both sides as I went deeper and deeper into health anxiety and became more scared of, you know, the heart and having heart problems. I could actually cause these symptoms in just my left arm. I could cause that. I could cause the tingling. But generally, one big difference between an anxiety attack and a heart attack is that, you know, an anxiety attack is going to have this, you're going to have a full plethora of symptoms. Like I said, there was a lot of mental symptoms that I was having that I probably wouldn't be having as much with a heart attack. Heart attack, you might have like 4 or 5 symptoms, whereas an anxiety attack, you're more likely to have this crazy ordeal, okay? Like, for instance, I had depersonalization. I felt like the situation was, I didn't feel like I was myself. I felt like I was watching it happen, okay? I was hallucinating. I was like seeing random things, you know? My vision got really freaking blurry, you know? It was unreal. Some other things, I had these crazy racing thoughts. I wanted to run away. I wanted to get out of there. I was like being, you know, irrational, you know? I was panicky. That stuff isn't necessarily the same situation, you know, the same kind of symptoms you're going to have if you're actually having a heart attack. It's like more dire. It's actually happening. You can tell, you know, there's more mental aspects with the anxiety attack because that's where it originates, you know. That's where the attack starts, in your head, all right? And then you get that adrenaline. There's this huge adrenaline rush that I'm not saying you can't have when you're having a heart attack because you're kind of, you know, you're in a panic mode also. But it's more physical, you know, in an actual heart attack. So keep that in mind. Also, heart attacks 99.9% of the time aren't just going to come and go. You're not going to have one and then the next day you're just fine, and then you're going to have another one the next day. Because if that was the case, I would have had thousands of heart attacks, okay? So you need to keep that in mind. Heart attacks don't just come and go like that. There's probably extremely rare cases where somebody had a heart attack they didn't know, but once they got the test done, the EKG and the blood work, they saw in the EKG that there was some damage done to the heart, which might have been, you know, a slight heart attack that they might have had, or a minor heart attack that could have caused a little bit of damage, and maybe the artery unclogged itself. But I'm telling you guys that does not happen very often at all. The symptoms get worse. It doesn't just go away. You need blood thinners. You need a relief, and that's what you're going to get from a medical professional. All right, so keep that in mind, that, you know, you can generally calm yourself down eventually with an anxiety attack. Mine lasted hours, so like I'm saying, it can be, excuse me guys, it can be very, very confusing because I had symptoms for a very long time. All right, so like I said, if this is the first time you're going through this, you might need to go get that reassurance to figure out if it's okay. And whenever they tell you it is an anxiety attack, I'm getting tongue-tied here, you need to believe them and trust them, okay? Because they can look at their EKG, they can do their blood work, they can tell what's going on in there. They're checking your, all your vitals. They hooked me up to a machine and they kept me there for an hour, okay? So you just need to do that. You need to trust them, okay? They're professionals, we aren't. Another thing, now I would get nauseated occasionally with anxiety attacks, but not super bad. Nausea can be tied in with the IBS aspect of anxiety, but with a heart attack, generally you will vomit more so than you would during an anxiety attack. Now you might get nauseated on both. Nausea is more associated with the heart attack, but I'm not trying to scare you with that, because I had nausea plenty times with panic attacks. But you're more likely to actually throw up if you were having a heart attack than you would, if you were having an anxiety attack. So something to keep in mind there. So those are just a few of the symptoms, guys. Heart attacks are, they can be a crushing pain, and I'm talking about just horrible. It doesn't go away. You can't get it out. You can't, one big difference for me is like whenever I had an anxiety attack, I would just take off running. I'd go outside, grab my shoes, and run, and that would generally give me, that would give me a reason to hyperventilate. I was actually running. It was more, it slowed everything down for me, and it would actually get me out of an anxiety attack. With a heart attack, you're not just going to have to go out there and go running and everything's going to be fine. It probably would worsen the situation. So I would just go running and I would actually calm down. So it was just one of those methods that I use. If this is not your first time that this has happened, like I said before, you really think that you're having, tens or hundreds or 1,000 heart attacks and you're surviving? I mean, I'm not trying to be rude or anything, because, I went through that too. I probably had, 1,000 of these attacks during those years. And whether that be in the car, the supermarket, or at my house, or in the shower, and I literally thought each time I was dying and I was having a heart attack. So you have my full sympathy there, but you have to start realizing, putting 2 to 2 together. Once you've been to get, you've gotten checked out, once you've been there and you've had your vitals checked for the 4th, 5th, 6th time, some people go almost, every other day to the hospital because they're scared and racking up medical bills. You have to start putting 2 and 2 together and realize that this is a mental issue, okay? That's one of the big key differences. You've gotten checked. You're not having, 757 heart attacks. If you are, that's crazy. You're a beast, I used to joke with people and say, man, I've survived like 1,000 heart attacks, man. It was kind of a joke that I had, with myself. It would kind of help me out. So eventually I kind of got over that and I started grasping, I would tell myself, Trey, you're not dying, get over it. And then generally the symptoms started getting less and less and less. And I kind of used this as time went on. I would just, I'd tell myself, no, we're not going down this road. And I was eventually strong enough to kick my health anxiety, at least the heart aspect of my health anxiety, to the curb. All right. So if you're going through this, my heart, I feel you. I understand what you're going through. If you're dealing with health anxiety, it's one of the worst things you can actually go through. It's very depressing. It's a long journey. There's no easy way out, but you can make changes to your brain by eating better, dieting, and meditating and practicing positive thinking. These things do help over the long term. It's what helped me. Okay, you got to rewire your brain. It doesn't happen overnight. Unfortunately, one panic attack can change everything forever because it's driven by fear, but it's not going to go away as easy because fear shot it up to the #1 spot in your subconscious, and now you got to deal with that. So it's an unfortunate situation. Mental illness is getting worse and worse, it seems like, in this world, and it's kind of swept under the rug and kind of looked at as a weakness, but lucky for you, if you go down the description, I've developed a group there and on Facebook, and I would like for you to join it. And it's basically for people going through anxiety and stress and panic attacks, and you can discuss your symptoms there. You can discuss what you're going through, share your story. We're up to 15 members in there. I want it to be a group where thousands of people where we're sharing tips and sharing stories and experiences. Also, follow me on my social networks down below. Definitely give this video a like so we can get that ranked up there on the search engine so people can see it, and leave me a comment down below. I'm sure many of you have had the same situation, where you've had certain symptoms and you've wondered, what's going on. Leave those down below. I'm curious to hear what you guys have been through, You know, I want to get a lot of comments on this. This video is long, it's 10 minutes. If you stuck around, thank you so much. Subscribe, hit that notification bell. Even if you've subscribed in the past, hit the notification bell, because you're gonna be able to get updates when I put these videos out, so you can get to them. Also, make sure that you follow all those social networks down below. I hope you guys have a great day, guys. I'm putting a playlist. Man, I'm getting tongue-tied today, and it's really messing with me here. Playlists up here for anxiety help. Also, I'm going to put a couple other videos. Anxiety over your heart, I'm going to put that one up here so you can actually click on that and get some more details on, you know, what I've been through. So thanks a lot, guys. Y'all have a good one.